This is episode 517 of the Rio Grande Foundation's Tipping Point, New Mexico. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I am very pleased to be joined by Judge Glock. He is the director of research at the Manhattan Institute, and he has been on Tipping Point, New Mexico with us once before. But this time he is making a special visit to Albuquerque, New Mexico, and is here in studio. And we're very pleased to have you here, Judge. So welcome to New Mexico. First time, huh?
Absolutely. And just beautiful part of the country. I can't believe I've missed it till now.
There you go. Well, I know you've got plans to head up to Santa Fe, but maybe you could take a drive down Central, a.k.a. the old Route 66, which you can take off your bucket list as driving down, the Mother Road, one of the most famous roads in America, and doing some in-depth research on the topic at hand, which is homelessness, because you will see quite a number of panhandlers and other folks standing around on the Central trying to collect money. So double win there for you. But anyway, that's what your topic is going to be at the event here in Albuquerque. And is it safe to say, just as a starting point, that there was something about the COVID pandemic or whatever happened during that time frame that magnified and enlarged the homeless problem as it stands here in the United States, but probably also in Albuquerque as well?
Absolutely. So there was a lot of things about the COVID pandemic that exacerbated homelessness, and specifically unsheltered homelessness. That's the homeless that most of us think of when we think of homelessness, out on the streets, sidewalks, parks, etc. That is different from the sheltered homeless. The majority of all homeless in America, about 60% actually, are in shelters. But obviously the homeless with the most problems, with the most effect on the communities, are those out on shelters and streets and parks and so forth. Now, one of the things that exacerbated the problem was the CDC, the Centers for Disease Control and Prevention, surprisingly made a recommendation pretty early on in the pandemic that state and local governments should not break up homeless encampments. Now, they claimed, as they did with almost everything they did during this period, this had something to do with disease prevention. But even in their statement, they admitted pretty clearly that, well, breaking up homeless encampments could lead people to have lack of contact with their service providers, nonprofits, and so forth. And so the CDC, again, as in so many other cases, did not try to weigh the immense costs and benefits of homeless encampments. They knew obviously nothing about homelessness. They merely claimed that, well, we have a disease in this country, and because of that, we're recommending, wink, wink, encouraging local governments to not break up these encampments. So you saw an immediate explosion in homeless encampments in many places when it was clear that local governments were not going to take any action against them. Now, the other, and to my mind, maybe even less excusable aspect of this is those recommendations about social distancing that the CDC and the federal government made about 6 feet and not having too many people in enclosed places. Those were also carried on into shelters as well. And the CDC and some of the federal government said, well, you'll try to rearrange your shelters so that you don't have so many people staying in the same rooms. And we understand some shelters couldn't do that. So what you actually saw, tragically enough, was a lot of shelters shut down a large number of their beds, some shelters almost by half. I know a shelter in my hometown of Austin, Texas, shut down a large number of their beds, the Salvation Army shelter. And again, the CDC, not understanding much about homelessness, not understanding the cost and benefits, merely was looking at the cost potential of COVID. Classic, if you have a hammer, everything looks like a nail. Not understanding perhaps getting people out of shelters onto the street might lead many homeless people to have problems far above and beyond contracting COVID. So the combination of the end of enforcement, partially due to the recommendation or behest of the federal government, and the reduction in shelters during COVID led to this explosion in encampments. And what we've seen in a lot of places is that once these encampments start, it's a lot harder to get them under control. And we saw that across the United States in 2020 and 21.
So, boy, the CDC, yet another thing that they said and told us all that at best was seemingly inaccurate. And to be honest, I followed the pronouncements of the CDC and the policies that they recommended and implemented over the span of this pandemic, and never heard this particular one. So, I mean, average citizens, maybe like myself, tended to ignore a lot of these pronouncements, and many times we were proven right. But are you saying that a lot of cities went along with this? This is kind of, from the CDC's lips to the actual policy making pretty quickly.
Yeah, and a lot of cities that sometimes had activist groups that already wanted to take minimal action against encampments, and sometimes some groups as well that were, let's say, hyper COVID conscious, that often tended to be run these nonprofits, sometimes run these shelters and everything, took the CDC's recommendation and took it as something as of a mandate. And especially since the federal government really pulls the strings in the vast majority of the United States in terms of homeless funding, they would have been foolish not to. The federal government lots of times does condition their homeless funding on following out orders or merely guidance or recommendations. So local governments, shelters, nonprofits, etc., took this as more or less an order. And like you said, the CDC sort of in its boundless overconfidence, its ability to reshape every aspect of American life, I'm sure with no more than a few hours consideration, issued these sorts of recommendations or orders that affected hundreds of thousands of people, without really much thought in what would be the long-term effects of that. And we certainly saw those in many places, and it led to a real tragedy out in the streets.
Wow, fascinating stuff. So I'm going to backtrack real quick and do a little more of a job of introducing you. You now at the Manhattan Institute, which you moved on to from the Cicero Institute. You're still based in Austin.
That's
now,
correct.
of course, Manhattan, New York City. What have you, in particular, looked at New York City as kind of their policies, just being such a major urban area, and now you're the organization you work for based in Manhattan? I assume they're based in Manhattan. Yeah. I don't know. They could be based in Queens. I don't know if they'd be called the Queens Institute or not, but the Manhattan Institute, specifically New York, it's because it's such a big city, and they kind of seem to culturally influence, if not policy-wise influence everybody else. So just talk about New York for a brief minute and their policies specifically.
Absolutely. So New York City is somewhat exceptional. It's exceptional actually in many different ways. But on homeless policy specifically, New York City is one of only 3 major cities to have what's known as a right to shelter. And a right to shelter basically means that anyone who shows up on a doorstep and can credibly claim to be homeless immediately gets put up in a shelter or some sort of hotel or other location by the city. Usually this is done by court order or sometimes settlement with these cities. And New York, in fact, has the most expansive right to shelter in the nation by most measures. And so there's been a fair number of studies that perhaps aren't entirely surprising that show that those cities, New York, Boston, Washington, D.C. most especially, that have a right to shelter, have a large number of homelessness, a much larger number of homeless than comparable cities would. So I forget the exact number. In New York, we're talking around the realm of 60 or so thousand homeless individuals, almost all of them sheltered. Most of the places that I look in or work in the past have had a large majority of the unsheltered. That is partially due to temperature. Not surprising, there are not a lot of unsheltered homeless in Maine or Wisconsin or Minnesota. But this right to shelter also encourages some, but not all, to get inside these shelter units. Now, that is coming into conflict with another issue that's in the news very much these days, and that's the migrant crisis. So one of the knock-on effects of the busing of migrants up into New York City is that under these New York City laws and settlements, they have a right to shelter. And New York City is now sheltering tens of thousands of people from abroad, and they simply don't have anywhere else to put them. In fact, they are renting out now a Roosevelt Hotel right next to Grand Central Station to house potentially hundreds of migrants there. And so what you're seeing in New York is some amount of the downstream effects of what this right to shelter can do. And not surprising, when you're faced with this kind of unbelievable influx of migrants, they're realizing the right to shelter isn't a catch-all for the rest of the for the homelessness problem. And it's certainly relative even to other large cities, relative to population. New York City has a lot more homeless people. But again, not the same levels of unsheltered as you see in Texas or California or Washington State.
Interesting. All right. Well, that dovetails nicely into the local policies and politics. Now, believe it or not, I know you said this is your first time here in Albuquerque. We actually are somewhat of a landlocked city in certain respects. We have the mountains to the east, we have tribal lands to the south, we have tribal lands to the north, and then the volcanoes and some lands that can be developed. But we're actually in the midst of a serious discussion at City Council and other places about a housing crisis, limits on housing. Now that's obviously homelessness is a part of that conversation. It's not necessarily the entire issue, but because everybody's dealing with inflation and housing costs going up. But talk about the philosophy of housing first and what that does in terms of homelessness.
Yeah, so as you mentioned, homelessness almost by definition, or exactly by definition, is a housing issue. It is someone who lacks a home and doesn't have a home to go to. As I mentioned last time I was here, the very term homelessness is something of an activist creation of the 1970s and 80s, where they tried to redefine a lot of related issues, everything from itinerancy to drug use to mental illness, as a singular problem of homelessness. But be that as it may, there is obviously a problem with people lacking homes, and that is related to housing costs. There have been a lot of different studies of cities across the country, and by some estimates, you can explain somewhere between 30 and 50% of homelessness in major cities as related to how high housing costs. And how high housing costs are very simply caused by lack of housing supply, caused with high housing demand. When I used to be an econ professor at West Virginia University, I used to joke to my students, if they ever fell asleep and I happened to wake them up with a question, they didn't know what the question was, merely repeat supply and demand, and good chance they'd be correct about that. Whatever the question happened to be. And again, with housing, it's very clear. There's not enough supply, especially in high demand cities that are growing. That's leading prices to increase. And in many places, I've advocated as one essential part of that growing outwards, which a lot of cities, especially in the West, refuse to do. But in some places you mentioned, including Albuquerque, that are somewhat landlocked, have certain mountainous or federally owned terrain, growing up is essential as well, finding new ways to densify and increasing housing production inside the city or in its nearby suburbs. Now, how can that relate to solving the homelessness problem beyond the fact that I already mentioned this? Obviously, reducing housing costs can help explain and potentially reduce significant amounts of homelessness, again, 30 to 50% perhaps. One that I would like to clarify in those numbers, and a lot of people out there claim that homelessness is only a housing cost problem. There's, in fact, a famous book, now much shared, that said homelessness is a housing problem, right there in the title. But as I said, by most measures, even a majority of homelessness is not explained by that. And most importantly, it seems most of the chronic homelessness and the unsheltered homelessness, which is what most of us think about in homelessness, does not seem to be easily explained by housing prices. We know this, for example, because you have many places with low housing prices that have a lot of homeless. And you have many places, such as San Francisco, Los Angeles, who've created thousands upon thousands of what are called housing first units or permanent supportive housing units, and yet have done nothing significantly to solve the problem. In fact, have seen homelessness increase. So Housing First is sort of taking that activist definition of homelessness, that homelessness is just a housing problem, and basically promising to give every long-term homeless person, especially the homeless on the streets, a free or heavily subsidized house. And that is the official federal policy at this point that most local cities and states are carrying out. As I said, unfortunately, we've seen a lot of different cities and states that have tried this model and it has not proven particularly successful. San Francisco itself built around, I want to say, 7,000 to 8,000 of these what known as permanent supportive housing units, housing first units. And of course, over the past 50 years, have only seen homelessness increase substantially. In fact, one of my favorite stats in this regard is that 11% of all of the homeless in San Francisco were previously in a subsidized housing unit. So there's a lot of people that have problems, obviously immensely beyond merely not being able to afford a rent check. And for most of the homeless that you see out in the streets, the sidewalks, and the parks, it usually involves, yes, mental illness, drug abuse, alcohol abuse, and physical disabilities.
Yeah. Albuquerque, among other things, has a housing forward ABQ plan, converting hotels and motels to housing. It's their vision is apartments would be basic but safe, professionally managed, mixed income. So I guess they're not going to directly focus on the homeless per se, but it's definitely something that I think that's being touted as a potential solution. And I don't know. What do you think of that? But based on that kind of statement there.
Yeah, so this was another kind of downstream effect of COVID, in that in the midst of COVID, there was an immense availability of hotel rooms that obviously no one was using when no one was traveling. And a lot of places, California most importantly, in their Project Room Key, said we can convert a lot of these hotels into either these permanent supportive housing units or into some sort of transitional shelter or so forth. And I think some of that is valid. Some of these places weren't being used. Some of them did serve as a function for some amount of transitional or shelter housing. But what California saw when they tried this out is converting these motels or hotels into long-term housing was not easy, especially for housing that was going to take a lot of hits. A lot of these things were built somewhat flimsily, or obviously built for people to stay in them short term, not to kind of house people often with substantial mental health issues for years or decades. And so the costs of converting them were very high. The cost of maintaining them were much higher than expected. And most importantly, perhaps, after COVID ended, there is not an incredible ability of excess hotel and motel rooms around anymore. By most measures, travel has returned to its previous peak, its pre-pandemic peak. And so there is not sort of just infinite number of empty hotel rooms to convert to affordable housing or hotels for the homeless. Again, as a short-term transitional or shelter system, some of that conversion may work. But it has to be short term. The goal basically is what's called non-congregate shelter. Most of you, your listeners or viewers, if they're thinking of a shelter, they think kind of as a big, like a basketball court room or a lobby style room with lots of beds laid out into that. And that is a lot of traditional shelters have that. And there's obviously a need for that. But what more people are recognizing is there's a lot of benefits for what's called non-congregate shelter, where you have one or two individuals in a certain room that have some amount of privacy and separation that cuts down on fights and conflicts and so forth. So hotels can provide that. Most of the time when they do convert them, they often have two to a room. And if anyone has shared a room with a roommate, they know that doesn't always lead to an absence of conflict. But it can potentially reduce it. But one of the other things we've also seen post-COVID is an increase in these what are known as tiny home villages, another kind of non-congregate shelter where you have small, everything from Oakland's renamed tough sheds, which are basically just sheds you would keep your tools in that are repurposed on the cheap for individual or by person housing, to kind of repurpose mobile homes and other sorts. So we are looking at a lot of strategies at this point beyond just the traditional shelter. I think hotels can be one aspect of that, but I think the hope from a lot of people that this hotel conversion was going to solve a lot of our housing affordability and homeless problems is just not going to play out.
Now, you drive around town, as we just talked about, and not just Albuquerque, it's a lot of major cities. I think Albuquerque tends to be on the high side when it comes to people out on the street corners and whatnot, but it just depends. What are there differences mentally? Are there differences in job status, marital status? What are the kinds of things that pushes somebody out of that kind of, maybe they're working, maybe they don't have enough money for a place or something, into the on the street issues? Like, there's people who are going through a tough patch, and then there's people who are legitimately homeless. Is it just drugs, alcohol, and mental illness, or what kind of drives people from relatively successful or stable lives, I would say, into that kind of homeless situation? Is it just a few bad breaks, or what kind of makes those people go that direction?
Yeah, well, it's not surprisingly, it's very dependent on the person, but there are a couple groups I often think of this as falling into, and think of them having usually distinctive causes. So it's not a perfect measure, but you can kind of divide the homeless population into thirds, where about a third are individuals, men and women, living in shelters by themselves. They've Another third are families, overwhelmingly single mothers with children who are living in, again, largely living in shelters. And there's another third that is the unsheltered, which is overwhelmingly but not exclusively male. And each of these groups does have distinctive problems. When you're looking at the individuals in shelters, they are much more likely, yes, to be people who missed a few paychecks, who need or missed maybe lost their job, missed a rent payment or two, need a little help out. Most of the people in shelters return to housing of some sort within a few months. Sometimes different places, different measures, but we're usually talking not more than 3 or 4 months. That's most of that. It gets resolved kind of
And
naturally.
is that, yeah, so you said natural resolve. I mean, aside from the shelter itself, do they need specific assistance? I mean, is it a matter of completing that GED or something like that, or just getting a job? Those seem to be the low-hanging fruit, obviously.
Yeah, and they have good caseworkers. I mean, one of the benefits of shelters in general is that they do have rules, usually, for the people that are staying in them, and they usually have a lot of access to the caseworkers that are usually at the shelter or come regularly to the shelter. And that allows people to connect to housing. Sometimes that means connecting to some sort of government services that they might be eligible for and weren't aware of. Sometimes that means getting them reconnected to family members. It's not an uncommon way to resolve. A lot of people make fun of what's sometimes called Greyhound therapy, which is giving a homeless individual a bus ticket to return to their original location. But one of the things we know is that loss of family connections is one of the most frequent causes of homelessness. Alan Graham, who does an amazing private-run homeless village called Community First outside of, again, my hometown of Austin, Texas, he says that homelessness is largely caused by the devastating failures in family and the collapse in the family. And that's true for a lot of these individuals out on the street. And so if you can reunite them with the family, that can go a long way. Now,
well, and let me jump in there because, I've dealt with this in my own family indirectly, and one of the challenges, and there's obviously families. What's the old line about? All of them function the same way, but all of them are dysfunctional in very unique ways.
The old Tolstoy line, yeah. All happy families are alike, but all unhappy families are dissimilar in their own ways.
Yeah. So, but one of the reasons that you wind up at that place is because the family has decided that you are just too much of a pain in the you-know-what, or that you have done too many things that they're no longer going to let you sleep on the couch or whatever it is. And I know, this is not slightly afield, but it's a very specific problem. But I think it seems like one of the more common ones. is it as simple as a specific, counseling that gets them back on their feet? Because these are the people that have the best opportunity to be productive, tax-paying members of society, et cetera, et cetera.
Yeah, it's really hard, and I think it's important to recognize. Yeah, when I mention that sort of collapse of family, a lot, and I might even say the majority of the people on that street are people who've lost contact with the family, never had a stable family to begin with. You see the numbers, and they're very divergent, but you see something like 25 to 50% of foster children become homeless at some point in their life. They just didn't have that to fall back on.
Yeah.
Now, I talk to so many people, and luckily I've not had to deal with this in my own family, but have been dealing with family members overwhelmingly who struggle with mental illness, drugs, and alcohol. And what happens, of course, is they burn through every family member and every friend until there's just no place else that will take them. And for good reason. The family member or the friends no longer want to support a lifestyle that's often detrimental to that individual, the child or the friend, or the cousin or whoever it may be. The friend may be, or the child may be an active threat to the family and may not listen to the family. I've talked to someone whose family would regularly try to get in contact with their schizophrenic son, but the simple truth was they only knew where he was when he would get arrested. Otherwise, they had no clue even how to locate him. They did everything on earth to try to reconnect with him, but it just wasn't possible. So two of the things that I think I haven't fully described yet, but I'll get to more, is that kind of final third on the unsheltered, which even the unsheltered circle in and out of shelter. It's often the unsheltered are more likely to be what's known as chronically homeless. That's mean homeless for more than a year. And that's a group that has overwhelming problems with drug, alcohol abuse, and mental illness. Now, if you will look at the stats provided by some of the activists, they'll say, look, it's only about 20% of homeless people have a substance use problem. Only about 30% have a mental illness problem. This is relatively higher in the rest of the population, but not overwhelming. Now, I think what that misrepresents is, one, a lot of times we get those numbers by just asking people, do you have a drug abuse problem? Are you mentally ill? And not surprisingly, a lot of them say no. I have... this is often asked, in fact, in many cities, on the street in the middle of the night. I have, as part of these annual counts, which are required for every large city, known as the point-in-time counts, I have gone up to individuals who are passed out on a bus stop at midnight, and you rouse them and ask, do you have a drug and alcohol problem? And they will glumly shake their head and say no, and you will mark that down as no. But anybody,
that's legitimately how they figure this out?
That's legitimately how some of these numbers come down from, and I've marked that down in my sheet that goes right into the government tallies that go right up to DC and get released into the nation. And anybody with a lick of sense knows that's not true, but there you go. So now what we do have some what I think is somewhat better numbers, where we've looked at people that are inside the homeless system trying to get help. And one study of the Western states, 15 states largely in the West, found that among the unsheltered, about 75% claim to have a substantial substance use issue, and about 75%, again, a substantial mental health issue. And about half of each also said it was mental health or substance use that was one of the reasons they lost their housing. So again, for the sheltered rates, you do have higher rates of mental health and substance use issues, but sometimes an order of magnitude different from what you see out of people out in the streets. And in those cases, you have family members who can't do anything to get someone inside. And frankly, the two things that can really help that enough cities and states aren't doing is, one, actively close these encampments. If you can get someone off a bus station or a bus stop or off a park in a tent and into a shelter where they can start to get some help, that will help the family get in contact them. That will help people start to get the services they need. And two, increase the viability of mental health commitment. As anyone who's struggled with a family member with mental illness knows, you often have to have your son or your cousin, whoever it may be, basically raise a knife over your head before you can get the state to come in and try to require some amount of treatment. So unfortunately, these mental illness and substance use issues are overwhelming problems among those who are out on the street and those who are homeless for long term. Usually, frankly, most people couldn't live that sort of life if they didn't have a severe mental illness and long term substance abuse.
Now, so it seems to me that the individuals in shelters and the addicts and chronically homeless, those two groups, there's kind of that swinging back and forth, and they may be the same group, but they split into those two thirds. Families with kids, obviously, extremely sympathetic. Seems to be likely domestic violence issues, that kind of stuff. How do you help those people who obviously no one wants homeless kids? Nobody wants anybody homeless, but especially homeless kids and that issue.
Luckily today, it's not an incredible comfort, but luckily you see very, very few unsheltered homeless families, kids or mothers out on the streets. And I've never met. I know people who have worked with some who just refuse to come inside, who want to live in their car, and that's their choice. You can't force them in most cases. But most of the time, if someone's going out in the street and they find a kid in a tent, they will do everything possible to get them in some sort of location. And often they will do everything possible to get them in some sort of permanent housing of some sort. Now, one thing that I would mention that I think we talked about briefly last time I was here, but I haven't discussed yet, is that the way this housing first model works can sometimes discourage families from getting that permanent housing, and that the housing first model specifically targets people who've been on the streets the longest, who have been unsheltered, and frankly, people who have more severe drug abuse and even criminal issues. So I described before, and I encourage your readers to look up the truth of some of these statements, is that a lot of states and cities have a scoring system they use to decide who gets this permanent housing. And you can get points towards permanent housing. And in a lot of these places, you can get, say, hey, 1 extra point for selling drugs, a bonus points for committing an act of violence. Unfortunately, for families with children, you actually get a bonus point for abusing your kids, for having your kids taken away from you for Child Protective Services. The most horrific example I know of is in Massachusetts, where the scoring system for homeless housing gives you 4 points if you are currently addicted to drugs and not in recovery. That's down to 1 point if you are in recovery for at least a year, but you get a bonus 2 points if you've overdosed in the past 12 months. Now, given those problems I've talked about with the largely single and often male population of the streets, those point systems will tend to privilege those sorts of individuals. And so if you're dealing with a mother who's been sheltered for a short period, who doesn't have a drug abuse problem, who doesn't have a criminal problem, who frankly is taking care of her kids, she can be further down the list on some of these long-term housing supports. And that's both very unfortunate because it's not helping the people who we would frankly be kind of most sympathetic for and maybe need this the most. But as I described before, it's also encouraging exactly the sort of behavior that we obviously want to discourage. If you're telling homeless individuals the way to get ahead in your life and move into permanent housing is to commit acts of violence, do drugs, overdose, etc., that's obviously not solving the problem. And to my mind, that's one of the biggest problems with the current system.
So we've got 10 or so, 12 minutes left to go here, and I know you work on solutions. Obviously, housing first doesn't seem to fit the bill. But if you were asked by the mayor of Albuquerque to come in and offer some suggestions that have worked in other places, and feel free to cite some of those other places that have been working through some of these models that actually work. What would those models kind of be, and what would you recommend that a city like Albuquerque do?
So every city is different, and I'm actually on the mayor of Dallas's task force for homelessness right now. We're hoping to release a report in the next few weeks, and so I've been looking at this in a bunch of different places. Now, in a lot of the cities I go to, such as Phoenix or San Francisco, there is no shelter capacity. There are more people out on the streets than there are inside. And so I often recommend setting up some of these very short term, what are known as sanctioned camping sites, or structured camping sites, which are basically just, hey, give someone a place that they can go that has police protection, that's secure, that has services on site, and give them some place where they can kind of, not if not move inside, move off the streets and the parks.
Those are called safe spaces here, I believe.
Okay, yeah, the different places have different.
Yeah, I think Denver had something like that. And
Yes,
maybe
Denver
Las
has done
Cruces.
some. The city of Portland, and I'll have to admit, when I originally began advocating for this 2 or 3 years ago, I had a lot of people claim that I was advocating for internment camps, for concentration camps, etc., when these were entirely voluntary. Now you have the mayor of Portland, of all places, who is setting up 4 of these sanctioned camping sites in a bid to remove all unsheltered people and encampments from the city streets within the next 2 years. So this is, in a lot of those cities that don't have enough sites, this is the kind of the first step.
Now,
Right?
just real quick, I mean, you've got these safe spaces, and the concern, and they were controversial here, remain so somewhat. They approved a couple of them, then they dialed it back. There was some shifting on the city council. I think the challenge is if you add yet another opportunity for homeless to be in some kind of place, and you don't push to clean up the streets to make sure that they're not in the open air, unauthorized encampments or on street corners, you're just more of a problem. But you're saying that Portland and some of these other cities that have succeeded with that are combining the enforcement and the safe spaces, for lack of a better word.
Well, yeah, some like Portland have just started. They haven't fully carried it out, but it's a growing trend. And again, I wholeheartedly agree with you. The goal should not be to have kind of permanent tent cities outside of American cities or inside American cities. Excuse me. The goal is to keep them short term. Ideally, is the next step, and to allow that enforcement, especially on large parts of the western United States, where they're subject to a Ninth Circuit court ruling that maybe a handful of your listeners are familiar with, the city of Boise v. Martin, which said you could not remove people from the streets if they didn't have anywhere else to go. So that satisfies some of that. But agree with you, long term they can be very problematic. And ideally, I've advocated, not always, that they keep similar time limits to what shelters keep. Shelters, usually by the federal requirements, should tell people they have to move on in 6 months, so someone doesn't just make the shelter their permanent home. So again, that's a start. But again, in Albuquerque, that's not entirely the case. According to the most recent stats, Albuquerque has almost 50% of its shelter beds unused right now. They're just not being used. And a lot of the advocates will say, they're because they're high barrier. High barrier, as the term means, they don't allow you to bring your pets in. They don't. Often they simply mean they don't allow you to do drugs or alcohol in the premises, that they're sober. Sometimes they don't allow you to have the partners and so forth. But to my mind, some amount of higher barriers is necessary to make sure these places are secure and reasonably kept. And we also know that places that have very low barriers, this kind of let anybody in and don't have any rules, that you just see chaos and violence. So those can be a solution. Now, the other thing is simple. I am a big advocate for enforcement. That obviously the goal is not to arrest someone out on the street. We don't want to put on handcuffs merely because someone is staying outside. But the idea that allowing the proliferation of tent cities and pervasive public sleeping in American cities is somehow acceptable is very surprising to me. Is even someone like me, or maybe you, who remembers many American cities in the 80s and 90s when they were disaster zones. Nobody imagined that a large number of people could just sort of set up tents in the middle of a sidewalk and nobody would do anything about that. But in many places, that's become the new normal. And so I think enforcement, when humanely done, does encourage people to move into those unused shelter spaces, requires them to get treatment, helps move them on to the next stage of their life. And we've seen a lot of examples of this. I sometimes like Colorado Springs in 2010, which reduced homelessness significantly by starting to enforce their camping ban, reunited a lot of people with families, got people in jobs. Los Angeles, of all places, from 2006 to 2014, significantly reduced homelessness and, even more importantly, reduced homeless deaths by enforcing a lot of the laws on their Skid Row. There have been some good academic studies on this, in fact, that show incredible reductions in homeless deaths and homeless crime because of this enforcement. So that's essential. And maybe the last thing I would add to that is something that's not currently used enough, and that's recovery housing. So the current housing first model for permanent housing is very low barrier. Basically, you give someone a house, even if someone's been out on the street for years, even if they have a severe mental health or drug addiction issue, and you say, we offer you service, but you don't have to take anything. And not surprisingly, for a lot of people with schizophrenic, bipolar disorder, etc., that's not enough. And instead of just giving these free houses without any mandates for treatment, having houses that have some sort of sobriety or mandated mental health treatment can really go a long way. I'm a fan of Oxford House, which allows people to live together in a sober environment and help former addicts recover together to move on to the next stage of their lives. And right now, the federal government doesn't do much to fund that, but they really should. And so should the states and cities that are looking at this.
Now, we just have a minute or two to go, and I may ask you the most difficult question right now, and I kind of taking it full circle here, but more metaphysically speaking, why do you think we have such an uptick in homelessness? Because I don't think government can do a great job of solving homelessness. They can do a good job maybe of minimizing the problems associated with it. But, is it family breakdown? Is it lack of religion? Is it just I can do anything I want kind of mentality in our society? What do you think some of those more deep-seated issues that are really, I think, contributing to this problem being so much more widespread? I mean, in the 50s and 60s, I don't know, I wasn't around, but you don't get the impression that every photo had some guy sleeping on a tent behind him. It seems like that was a much more limited issue in those days. Am I wrong, or what do you think's really at the heart of this stuff?
Yeah, it was more limited, especially in the post-World War II period. Homelessness was not exclusively, but largely confined to older alcoholic men. If you look at movies and other groups in the 60s, that was the people who were kind of considered homeless. And the kind of broad range of homelessness we started to see in the 80s and onwards, drugs were a big part of that. The deinstitutionalization of the mental ill was a part of that. The lack of ability to get treatment for the severely mental ill was a part of that. Family breakdown was a part of that. Yes, some of those cultural mores you change is part of that. But partially the government in the more recent years, basically, again, allowing the proliferation of tent camps, along with the obviously incredible increase in drug abuse, both for the housed and the unhoused, has been a big part in explaining the uptick of homelessness. And frankly, I think one reason has been this failed housing first policy that says, well, if you're homeless for a long time, we might give you a permanent house for the rest of your life for almost for free. And I think that has led some people openly to kind of game the homelessness system. And long term, it hasn't shown a lot of positive effect for reducing homelessness in the country.
All right. Well, there's so many more questions and things we could talk about, but we're going to leave it right there. Thank you, Judge Glock, and thanks for listening to this week's episode. Find all episodes at tippingpointnm.com or at the Rio Grande Foundation's YouTube channel. Subscribe to the show at Apple, Stitcher, or tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.